Well, certainly grade 1 ankle sprains are probably the easiest to treat, and these are the ones that we see most commonly with our weekend warriors and also our athletes of any capacity. And those are patients that we typically will place in some sort of supportive brace, whether it's an ankle stirrup brace or an air cast. And it's important that we follow the recipe of rest, ice, elevation, and compression. And we also try to get these patients into physical therapy as quick as possible. We find that the faster we're able to get the swelling and the fluid and the inflammation out of the joint, the faster the patients are able to return to athletic activity. In patients with a grade 1 ankle sprain, we'll often fit them with something called an air cast. And this is basically a stirrup brace that fits on the inside and outside of the ankle to basically give it support. In patients who have a grade 2, a strong grade 2 or a grade 3 ankle sprain, we'll get patients fitted with something called a cam walker boot, which is a very protective, soft, spongy boot that will act almost as a cast for the patient that they can bear a little weight in and often use some sort of assisted device such as a crutch or a walker to help them with mobility. And then in patients who are active or are in an athletic situation, and even some patients who are recovering from a prior ankle sprain, we'll fit them in something like this, which is called a velocity brace. And this has a nice rigid outer and inner structure, but it also has laces for nice tight stability of the ankle so that patients are in an athletic situation have the support that they need without having to worry about their ankle giving out or twisting. Grade 2 and grade 3 ankle sprains are a little bit more challenging to treat in the respect that we follow the same paradigm of treatment. However, the time for those patients to heal is a lot longer. Your typical grade 1 ankle sprain will heal in about 2 to 3 weeks, whereas grade 2 and grade 3 can often lead to 4, 6 to 8 to 12 weeks in the most severe cases. It's not uncommon for a grade 3 ankle sprain to actually take longer to heal than an ankle fracture. Because of that, it's imperative that those patients are in physical therapy. It's imperative that those patients are really doing their strengthening and stretching exercises to get the ankle back into the shape that they need to do their activities. In severe cases, we'll see a rare instance where we'll have to go and arthroscopically clean out a joint, especially in a severe grade 2 or a grade 3 ankle sprain where there's so much soft tissue damage to the inside of the joint that we have to go in arthroscopically and clean it out. But typically that's not done for about 2 to 3 months. Or even sometimes up to 6 months, depending on how the quality of their physical therapy regimen is following. And on a different note, high ankle sprains, it's imperative to look at your x-rays with good scrutiny. And it's also important to look at the MRI so that you can see, and if there's a ligament tear to the ligaments that hold the tibia and the fibula together, it's almost always a surgical situation where you have to screw the bones back together so that the ligament can heal itself. It's important to remember that the ligaments in our ankle are there to create a healthy and stable environment for the foot to support us on. And if those ligaments are not functioning the right way, what will happen is the ankle will continually start to turn and they'll get repetitive sprains. And the more repetitive a sprain, the more problems the patient will have in the future, and that can lead to a ligament that does not heal. That can lead to a situation where the patient will step on something as small as a pebble on the road and their ankle will overturn, and that can become a situation which can again lead to a surgical problem.
The time spent in physical therapy is dependent on the phases that you're in. Acute phase usually takes about 4 to 7 days. The middle phase, the recovery of range of motion phase, could take from 7 days to about 2 to 3 weeks, depending on what type of tear or disruption they may have. And then to recover to full activity could be anywhere from 7 days up to about 4 to 6 weeks. Goals following an ankle sprain are primarily rest, ice, compression, elevation. We rest the injury, immobilize it so it has a proper healing environment. Ice helps decrease the inflammation. Compression will help decrease the swelling. Elevation also helps decrease the swelling, decreases the amount of blood flow to that area. The intermediate phase then would be to restore range of motion, start proprioceptive basic strengthening exercises, and then the last phase would be to sport-specific or work-specific goals as far as what they need to do. Do they need to climb ladders? Do they need to go back to running activities? Or are they more sedentary? Proprioception's the body's ability to realize where it is in space and how to react to the forces, uneven surfaces. Your foot hits the ground and it's an uneven surface. So it has to know where it is, and then it has to fire the appropriate muscles to respond to that uneven surface. If we were in a general environment where there's no clutter or uneven surfaces, it probably wouldn't be important, but it's not an ideal environment. These people are working in steel rooms, stepping over steel structures, stepping in ditches. We really need to strengthen them and prepare them to get back into their activity. First thing we're going to do is warm up your ankle. Okay, things stretch better when they're warmed up. We're going to do ankle pumps up and down. You're going to do 30 to 50 reps at home. Then you're going to open your legs up a little bit. Then you're going to go in and out. We start with a warm-up, simply just ankle pumps in all different planes. From there, I usually like to do a towel stretch where we pull the foot into a dorsiflex position or pull the foot up towards the shin. From there, I like to get the patients on their feet. We do that same stretch in a standing position. We go into the strengthening phase. I start with single leg balance, move the opposite leg in different planes to throw themselves off balance. And that gives them some proprioceptive response, and it also gives them some strengthening in a standing, more functional plane versus having them do something on a table. Then from there, I will go into a lunge matrix where they're lunging at different angles, and that will give them their deceleration and explosion in a different direction. Sports athletes and industrial athletes I treat basically the same. The only difference is the sports athletes has more of an explosion type, a type 2 fiber. So we need to train them in that quick explosion type mechanism also. So we'll get their flexibility and everything back to a certain point, and then we have to take them to that next level. They need that quick reaction time. Reoccurring ankle sprains are more common when they do not follow through with rehab. It's when they have a plantar flex foot or they don't regain their full range of motion. The ankle is what they call in a loose packed position. So anytime they step on an uneven surface, the ankle will roll to the weakest point and it will roll over to that sprain. If they regain their full range of motion, the ankle structure is able to lock up and it's more stable, and you're less likely to have a recurrent ankle sprain. And I always tell my patients, it's not that I'm treating your ankle sprain, I'm trying to prevent a reoccurrence. 95% of how well the patient does is what they do with their home exercise program. I only see the patient 2-3 times a week for maybe a half an hour to an hour session. They're with themselves 24/7. The immobilization phase, the resting position for their foot is hanging down. So the back structures of their leg get tight. So just the resting phase of what we put them in creates a contracture of the ankle. Now, it's very important, since they're in that position 7/8 of their day, that they do their home exercise program to counter the effects of that immobilization. Seeing me 2-3 times a week isn't going to do it. The exercise program started the first time they come into the office, and we assess the success of that home exercise program each time they come in.
After an ankle sprain, physical therapy is very important, but you have to remember to be consistent with that home exercise program. It's the home exercise program that will help you return faster to the activities you enjoy. Those exercises focus on range of motion, strength, and proprioception, your body's ability to balance and stabilize. Whether you have to get back to sports or work or even just leisure activities, it's important to continue working on that ankle strength and stability. Normal ankle function is essential to any weight-bearing activity that you do. At Coordinated Health, we work as a team in your education and treatment, but you're a key member of that team. Maintaining a stable, pain-free ankle means working hard to understand and apply the physical therapy principles we teach you. Stretching and strengthening your ankle consistently allows better performance of all your sports and daily activities without pain. And that's the art of medicine.